MLT Case Study Series 31. Unveiling the Cryptic, a case study on karyotyping for diagnosing acute myeloid leukemia with the Philadelphia chromosome. From symptoms to molecular insights, bridging clinical observations and genetic diagnostics in AML. Case Study, Diagnosing AML with the Philadelphia chromosome. Patient Profile. Age, 45 years. Sex, male. Symptoms, fatigue, fever, unexplained weight loss, and frequent infections. Medical history, unremarkable. Physical examination, splenomegaly and petechiae. Laboratory findings. Complete blood count, CBC anemia, thrombocytopenia, and elevated white blood cells, WBC, with blasts. Bone marrow aspirate, hypercellularity with 60% blasts. Immunophenotyping, presence of myeloid markers. Molecular tests, pending. Karyotyping procedure for AML diagnosis. Sample collection, bone marrow aspirate is collected as it provides a high concentration of the cells of interest. Cell culture, the sample is cultured in a medium that stimulates cell division, allowing for the observation of chromosomes during the metaphase stage of cell division. Harvesting and staining, cells are harvested, treated with a hypotonic solution to swell them, fixed with a fixative, and then dropped onto slides. The chromosomes are stained with Giemsa stain to highlight the G-bands. Microscopy and imaging, the slides are examined under a microscope, and images of metaphase cells with well-spread chromosomes are captured. Analysis, chromosomes are analyzed for number, size, shape, and banding pattern. A karyogram is prepared by arranging the chromosomes in pairs according to their size and banding pattern. Diagnosis. The karyotyping reveals a translocation between chromosome 9 and chromosome 22, creating the Philadelphia chromosome, T9, 22, Q34, Q11. This chromosomal abnormality is a hallmark of chronic myeloid leukemia, CML, and can also be found in a subset of patients with AML. The presence of this translocation is critical for diagnosis, prognosis, and treatment planning. Discussion. The detection of the Philadelphia chromosome through karyotyping is pivotal in the diagnosis of AML in this patient. The translocation T9, 22, Q34, Q11 leads to the formation of the BCR-ABL fusion gene, which has a pathogenic role in the development of leukemia. This genetic aberration is not only diagnostic but also prognostic and predictive of response to targeted therapy. In AML patients with the Philadelphia chromosome, targeted therapy with tyrosine kinase inhibitors, TKIs, is often employed, which specifically inhibits the BCR-ABL fusion protein. This treatment is in addition to chemotherapy and may significantly improve the prognosis. Conclusion. For medical laboratory technologists, understanding the karyotyping process and its application in diagnosing genetic abnormalities such as the Philadelphia chromosome in AML is essential. The accurate detection and interpretation of chromosomal abnormalities can guide the treatment plan and potentially improve patient outcomes. This case study underscores the importance of karyotyping in the molecular diagnosis of leukemia and highlights the role of laboratory technologists in the diagnosis and management of genetic diseases. Thank you. Please subscribe for more videos.